Every time you poop, your body leaves you a report right there in the toilet. But most people flush it away without ever reading it. Your stool often changes before your blood work does and before you feel any symptoms. Hello, health champions. Today I'm covering 10 signs your poop is trying to warn you about something and which ones you really need to pay attention to and which ones you can ignore. So your gut is really fascinating. It's a processing machine. It's a tube where you put things in one end and other stuff comes out the other end. But in between, food is broken down, nutrients are absorbed, and waste is separated and shipped out. But every step along the way, how well it's working leaves a clue for the final product. When something isn't working just right, then there can be changes in the color, consistency, content, and in the frequency and regularity. So you can think of it as a free automatic diagnostic tool if you just know what to look for. Under color signals, the first one is if your stool is pale or clay colored. So normally it's supposed to be brown, and what gives it that brown color is something called bilirubin that is carried in the bile. So when your red blood cells have outlived their usefulness at the end of their allotted time, then they get broken down. They get sent to the liver, and via the liver that gets broken down further into bilirubin, which the liver then puts into the bile. And if the stool is pale, that means the bile and the bilirubin is stuck in the gallbladder. And that could be caused by gallstones, bile duct blockage or obstruction, and also by some types of medication. So certain types of cholesterol medications and tuberculosis meds, antibiotics and chemotherapy medication can all do that. And then also you need to check anything that becomes persistent. And what does that mean, persistent? I'm going to use that term throughout the video. So every time I mention it, it means if something lasts for several days, or if it keeps coming back for several days to a couple of weeks, then that is not a good thing. It's not just temporary, it's something that you need to have checked out. Or if anything is accompanied by a symptom such as weight loss, pain, fatigue, etc., and you have bowel changes at the same time, then you want to think this means something. Number 2 is black and Tarry stool. And if it's what we call a true Tarry stool, not just dark, now it's because of digested blood. And the medical term for that is melena. And what happens is blood will turn black as it's being digested. And there's a difference depending on where this bleeding happens. So if it's an upper GI bleed, meaning it has a long way to go before it reaches the exit, such as the stomach, the esophagus, or the upper small intestine, now that blood has plenty of time to get digested before it gets out. And what's characteristic about this, if it's dark and caused by a bleeding, is that it's going to be sticky. It's going to stick and cling to the toilet bowl. It's going to have a foul smell. And it's not just going to be dark. If it has these other things in addition, now it's probably due to a bleed. And we want to contrast this with some other things, some benign things that can cause a dark stool. If it looks really, really dark, it could be from iron supplements. It could be from Pepto-Bismol. It could be if you ate something that has a lot of black color in it, like black licorice or activated charcoal, then it could also turn black, and it would probably be benign unless it is also sticky and foul smelling. And when we talk about bleeding and color changes, I want to mention this. I call it 2B. It's when you have a slight color change, or so slight that is not really visible if you don't really know what you're looking for and pay attention. And this could be if you have a very slow bleed. It's going on chronically. It's just a little bit all the time, but it may not be enough to change the color enough that you notice. But over time, you could still lose quite a bit of blood, especially if you're still a menstruating female. And over time, this blood loss could lead to iron deficiency anemia. So what you want to look for in that case is if you also experience some symptoms like fatigue or weakness or pale skin or shortness of breath. Like if you're climbing stairs and you get winded where you normally wouldn't, then you want to think this might be going on. But if it's not enough color change to be visible, then realize that you need blood work to check this out. But it's a very simple test. It's the simplest blood test there is, called a CBC, complete blood count. Sign number 3 is red stools. And if it's red, that means it's fresh blood, that it hasn't become digested yet. And that's because the bleeding is so close to the exit that it doesn't have time. So if it's in the colon, in the rectum, or even on the or around the anus, then that could result in fresh blood. So something like hemorrhoids or an anal fissure could cause that. And then on the benign side, something that could color your stool would be if you ate a lot of beets, if you ate something with a lot of red food dye, or also foods with tomato in them. But this would have to be quite a lot. Like if you lived an entire day on tomato soup or on beets, then that could happen, but not just from having a little side dish. Also worth noting is if you find this red color on the toilet paper, or if it's mixed into the stool in the toilet bowl. So if it's on the toilet paper, now it's more likely to be hemorrhoids or anal fissure, whereas if it's mixed in, now it's more likely to be a lower bleed in the colon, rectum, or anus. And again, if it's persistent or if it's large amounts, now you need to have it checked out. And the fourth color signal is if you have yellow or greasy stool. Now, this is also often going to be foul smelling. And it's due to the fact that fat is not being absorbed properly, and this is called steatorrhea. If there's a lot of fat remaining in the stool, and this could be caused by a lack of pancreatic enzymes, especially lipase. It could be a lack of bile or an interrupted flow of bile. Then we don't get that initial breakdown of fat. And it could also be celiac disease because then the gut is in such poor condition that it hardly absorbs anything. And this is usually not diet related. So it's not because you're eating too much fat that it ends up in the toilet. It's usually not diet related, except if you have celiac, because then it is diet related and it's specifically gluten that you need to avoid. And if this is persistent, you have it checked out. Number 5 is floating stool. And the first reason would be if there's still fat in it, like we talked about on the previous slide. The second reason is if there's gas in it from fermentation. And this wouldn't necessarily be so serious. It's typically diet related. Maybe you ate more fiber and carbs than you usually do. Maybe you ate different types. However, it could also be a little more serious if you have some significant biome problems. Because the microbiome, the bacteria down there, they are who breaks down your fiber and your carbohydrate in the diet. You can break down some of the carbs, but you can't break down fiber and a lot of plant compounds. You need the gut bacteria for that. So something that could be going on is dysbiosis, which simply means an imbalance in the bacteria and the life forms down there. Or also, what's very common these days is SIBO, small intestinal bacterial overgrowth. And now, a lot of people get severe bloating anytime they eat fiber or carbs, and it's because the bacteria are in the wrong place, right? The small intestine is where you're supposed to absorb nutrients. You're supposed to break down the starch early on and then absorb those nutrients. The fiber is supposed to go down to the bacteria in the colon. So with SIBO, the bacteria are in the wrong place, and that causes severe bloating. And one of the ways you can tell the difference between if it's fat or gas would be if it is foul smelling, then it's probably fat. And if you haven't noticed any significant change in odor, then it's probably gas. The thing to remember is if it's persistent, now you need to get it checked out. Your stool can also be too hard or too loose. So we're going to spend a minute here on the Bristol stool scale. It's got 7 steps, and the first one is if you basically are passing little balls that are very hard to pass. Or number 2 is if it is sausage shaped, it holds together, but it is lumpy and hard on the surface. Number 3 is if it has that sausage shape, but it's kind of smooth, it just has some cracks on the surface. That's better. Or if it's sausage, but it is smooth and soft, but well-shaped, that would be number 4. Number 5 is if they're soft blobs, but they have clean-cut edges, it still holds together and it passes easily. Number 6 is if you have fluffy pieces with ragged edges and it's mushy, it kind of starts dissolving when it hits the water. Or number 7 is if it's watery and liquid. If there are no solid pieces at all, basically diarrhea. So, out of those 7, the 3 middle ones are basically okay. There's no problem here. It's working the way it's supposed to. And if you're on the number 3 here, you just don't want it to get too hard. If it's on the number 5, you don't want it to get too soft. So what we're going to talk about now are the other 2 extremes, if it's too hard or too soft. Now, if it's too hard, that means that there's a slow transit. It takes too long for the poop to pass, to get all the way through from when you ate it to the exit. And why this matters is that now water gets absorbed, so it gets really hard, but also toxins get reabsorbed. Things that were put in the colon for the purpose of getting rid of in the large intestine, they sit there so long that they get reabsorbed along with the water. Some of the more common causes are if you have a low fiber diet, if you're dehydrated, if you eat the fiber, you need the water to sort of carry the fiber. But also low activity, because when you move, you stimulate your body to move the gut as well. You you increase the peristalsis. It can also be a microbiome imbalance because if the mix of bacteria that you have don't make enough short-chain fatty acids, that can also slow down the bowel. If you have a hypothyroid, if you have a slow underperforming thyroid, that can also make your gut slow down because the thyroid's a thermostat for every cell in your body. It tells the cell how fast to do everything it does. And if the thyroid is slow, your bowel's going to be slow. It can also be because of many medication side effects. An additional problem of it being too hard is that you might have to strain a lot to pass it. You spend a long time on the toilet, and this in turn could lead to hemorrhoids and discomfort and bleeding. And the number 7 is if it's too loose, like we talked about, this is because the transit is too fast. And the problem here is if it's moving that fast, it's going to take water with it, which can lead to dehydration. It could be due to infections. The body's trying to get rid of it, get it all out as fast as possible. It could be food intolerances, and it could also be due to stress. And if this becomes chronic, you have it all the time, this is going to point to IBS or IBD. IBS is irritable bowel syndrome, which is more of an unknown cause, but we know it's linked to stress. It's when nervous people, angry people, stressed people, their gut just keeps emptying. And IBD is inflammatory bowel disease. That's like celiac disease and Crohn's disease. Very often there's an autoimmune component to the IBDs. Now, if this happens occasionally, then you're usually fine. Every one of us have had times where we eat something that didn't agree with us, but next day we're fine. However, if this becomes chronic or frequent, now you really need to check this out to understand what's going on. Now we're on to content signals. That's what's in or on the stool. Number 8 is mucus. So in your large intestine, it's normal to have a barrier of mucus that protects the intestinal lining, and therefore a thin, clear coating on the stool is normal. That just makes it a little more slippery, and it helps the stool to pass more easily. Now, excess mucus is a different story. That's a warning signal. If you can clearly see it, if it's kind of floating on the water, then it's not a good thing, especially if you see it in a combination with something else like blood, or if you have symptoms like pain, or there's other changes at the same time. And often you can see these with IBS, IBD, like Crohn's, ulcerative colitis, celiac disease, or also with infection. If it's just for a day or two, but your body fixes it, it was probably something temporary like infection. But if it's frequent or there's a lot all the time, then get it checked. Number 9 is undigested bits of food. So we've all seen this where small bits of corn or seeds or bean skins will end up in the toilet, and a little bit is perfectly normal. There's just some fiber that is very difficult to digest, and that's going to end up there. However, large pieces or large amounts, or if it's additional, if it's greasy, then that's not normal. That would point to a problem upstream from there. And we might be experiencing low levels of hydrochloric acid in the stomach because then we can't break down protein properly. We also can't break down and absorb minerals properly. A little bit further down in the digestive tract is the pancreas. And if we're low on pancreatic enzymes, now we can't basically fully digest either protein or carbohydrates or fat. Little bits and pieces of food could also be due to a microbiome imbalance because with a reduction in microbiome function, now there's less breakdown of fiber and plant materials. They're basically the ones who do that for us. You as a human are not very good. You don't have the enzymes to break down fiber and a lot of plant compounds, but your bacteria can if you have the right ones in place. So if you see an occasional change, that may not be a big deal. Maybe you just had more or a different kind of fiber than you're used to. But again, if it's frequent or large amounts or if it's symptomatic, then you need to have it checked. And some of those symptoms could be weight loss, fatigue, or bloating. Number 10 is frequency changes. You want to be regular and normal. So the first question, though, is what does that mean? Everyone who's been in clinical practice and talked to people, you've come across at some point someone who says that I am regular. I go every week, just like clockwork. Well, that's not necessarily a good thing. Regular doesn't just mean at regular intervals. You need to have a certain frequency. So normal is considered 3 times a day to 3 times a week. But let me qualify that a little bit. So on this spectrum, once you're getting closer to 3 times a week, now you're not really in the green zone. You're approaching a warning zone. So in order to be normal, first of all, it's not just the frequency. It has to be well formed also in order for it to show that everything is working. So if you ate 3 meals a day with plenty of bulk and fiber, then it's totally fine if it's well formed to go 3 times a day. And if you only go 3 times a week, now what's going to happen is that sometimes you go every 2 days every 3 days. That means the food is sitting there for 48 to 72 hours. And those are some of the things you're trying to get out of the body. And some of them are going to irritate the lining, and you're going to increase the reabsorption of things that we're supposed to get out. So as you're going 48 to 72 hours, that's really not totally okay in my book. I would try to get that to at least once a day. And some of the things you could try is to increase fiber, you could increase water, and you could increase exercise. Now, if you're already drinking a ton of water, if you're going to the bathroom to pee every hour, every couple of hours, then obviously water isn't the problem. So just give it some thought and see what you might be missing, but 3 times a week is not quite enough. So what we're really talking about is if there is a sudden change relative to your normal pattern, either an increase or a decrease. And if you have an increase in frequency, this could be an infection, body's trying to get it out, food reaction, same thing. If you're hyperthyroid, that we talked about hypo, which is underperforming thyroid, which will slow everything down. Well, hyper is the opposite. Overperforming will speed everything up. And it could also be IBS or IBD, like we talked about. If you're seeing a decrease in frequency, like constipation, now you may not get enough fiber or water, like we talked about, could be the hypothyroid we mentioned. And it could also be medication side effects. There are some that are extremely common, like opioids that were overprescribed, addictive painkillers. Well, one more thing they do is constipation is very common. You can pretty much count on constipation. A majority of people would get constipation. And then there are the very, very popular GLP-1 drugs like Ozempic. And GLP-1 is a natural substance in the body. It's released when you eat. So certain things happen in your body when there is food in there. Your gut starts to slow down certain things so that you can process the food. Well, GLP-1, it mimics fullness, but there's nothing there. So you're tricking and you're bypassing your body's natural systems, which is not a good thing at all. And these drugs, they will slow down the emptying of the stomach. They will slow down the motility of your entire digestive tract to the point where this can lead to gastroparesis, which is like complete paralysis of your digestive tract where nothing moves anymore. And the rule of thumb, like I mentioned many times in the video, is if you have sudden changes, unexplained changes, or anything that lasts more than a couple of days to a couple of weeks, now you need to get it checked out. If you enjoyed this video, you're going to love that one. And if you truly want to master health by understanding how the body really works, make sure you subscribe, hit that bell, and turn on all the notifications so you never miss a life-saving video.